If someone tells you that everyone is going to get infected, tell them that you're willing to wait to be the last person. So here we go. Just sharing something that was shared with me. As time passes in a pandemic, there's a greater chance of survival for those getting infected 3 months later, like in June 2020, we see here, and now into July, than those who were infected in 3 months earlier, let's say the February-March period. The reason for this is that doctors and scientists know more about COVID-19 now than they did 3 months ago, and hence are able to treat patients better. I'm going to share with you 5 important things that we know now that we didn't know in February 2020 for your understanding. Number 1, COVID-19 was initially thought to cause death due to pneumonia and therefore a lung infection. So ventilators were thought to be the best way to treat sick patients who couldn't breathe. Now we're realizing that the virus causes blood clots in the blood vessels of the lungs and other parts of the body, and this causes the reduced oxygenation. Now we know that just providing oxygen via ventilators will not help, but we have to prevent and dissolve the microclots in the lungs. This is why we are using drugs like aspirin and heparin, which are blood thinners that prevent the clotting. Okay, hear that one out. Aspirin and heparin to prevent the clotting as a protocol treatment in regimens in June 2020. Number 2, previously, patients used to drop dead on the road or even before reaching a hospital due to reduced oxygen in their blood. This is the oxygen saturation levels. This was because of happy hypoxia, where even though the oxygen saturation was gradually reduced, the COVID-19 patients did not have symptoms until it became critically less, sometimes even as low as 70%. Normally we become breathless if oxygen saturation is below 90%. This breathlessness is not triggered in COVID patients, and so we're getting the sick patients very late in the hospitals in 2020. Now, since knowing about happy hypoxia, we are monitoring oxygen saturation of all COVID patients with simple home use pulse oximeters and getting them to hospitals if the oxygen saturation drops below 93% or less. These are about 500 pesos on Lazada, just so that you're aware that these are accessible. This gives more time for doctors to correct oxygen deficiency in the blood and a better survival chance in June 2020. Number 3, we did not have drugs to fight the coronavirus in February 2020. We were only treating the complications caused by it, therefore hypoxia. Hence, most patients became severely infected. Now we have 2 important medicines, of which I'll let you read those names. If you've got a nursing background, you'll probably say them way better than I, but here is what they look like. Both of these are antivirals, which can kill the coronavirus. By using these 2 medicines, we can prevent patients from becoming severely infected and therefore cure them before they go to hypoxia. This knowledge we have in June and July was not available in 2020. Let's have a go at reading these together. Favipiravir, maybe, and remdesivir. Okay, and that one's an injection, the other one's a pill form. Number 4, many COVID patients died not just because of the virus, but also due to patients' own immune system responding in an exaggerated manner called cytokine storm. All right, this stormy, strong immune response not only kills the virus, but it also kills the patients. In February 2020, we didn't know how to prevent it from happening. Now, in June 2020, we know that easily available medicines called steroids that doctors around the world have been using for almost 80 years can be used to prevent the cytokine storm in some patients. Number 5, okay, we also know now that people with hypoxia become better just by making them lie on their belly, known as the prone position. Apart from this, a few days ago, Israeli scientists have discovered a chemical known as alpha defensin produced by the patient's white blood cells can cause the microclots in blood vessels in the lungs, and this could possibly be prevented by a drug called coccicine, which is used over many decades in the treatment of gout. Wow, these just incredible people learning so much. Thank you. So now we know for sure that patients have a better chance of surviving COVID-19 infections now in June and July 2020 than in February 2020, that is for sure. India has not peaked in March or April because of the lockdown, and this strategy has postponed the COVID-19 pandemic in India by 3 crucial months that has enabled India to save thousands of lives. Going forward, there's nothing to panic about COVID-19 if we remember that a person who gets infected later has a better chance at survival than one who got infected earlier. Let's all follow the simple precautions like 6 feet distancing from each other, wear proper masks, work from home wherever possible, order delivery and takeout of food and groceries and vegetables, which reduces your exposure being out in public. Stay at home during lockdown and wash your hands and do your hygiene, all the things that we've been continuously reminding each other about. And realize that if you do go out into the public, then naturally, which we need to do, it's all about protecting your space to keep safe. Wear a mask and do your hygiene, you're going to be safe. Protect your space, you are in control. With this, we can beat the virus. If someone tells you that everyone is going to get infected, tell them that you're willing to wait to be the last person. Who knows? By then, we might even have a vaccine. Stay safe, act with love, be a leader in all that you do. You've got this. Feel free to share this with your loved ones so they've got some more information as well. The more info we have and more data, the easier it is to reduce the fear, doubt, worry, and concern that people have. You are in control. Stay safe. Have an awesome day. Power clip to finish on 3. 1, 2, 3.